Hello, my name is Kim.
And my name is Laura.
Our research topic that we will be presenting on today is anxiety.
So, what is anxiety? Anxiety can be defined as a normal adaptive reaction as it creates a level of arousal and alertness to danger.
Why is this important? About 10 to 15% of young children experience internalizing problems, and such rates of anxiety and internalizing problems tend to increase across childhood and adolescence with long-term consequences. This may put youth at risk for academic failure and may predict later illnesses if it is left untreated. Such illnesses can include panic attacks, depression, separation anxiety disorder, conduct disorder, social phobias, and lastly, suicide.
So, here are some facts about anxiety. So, age 6 is the median age of onset for anxiety disorders. 80% of youth with anxiety disorder do not get treatment. Therefore, some students will rely on school as their main resource. Anxiety with age is expressed as something becoming more social and abstract with time.
Some research related to our topic includes studies that were conducted to test whether parenting style was correlated to childhood anxiety. Bacedo 2009 researched adolescent parental overprotection and parental rejection, and both were significantly associated with increased rates of social phobia in offspring.
Paul 2012 mentions that behavior inhibition from toddlerhood to middle childhood were consistently associated with increased risk for phobias in early childhood and social anxiety in early adolescence.
There are two developmental theories that are relatable to our topic of anxiety: Bronfenbrenner's ecological systems theory and Erikson's psychosocial theory. Both views give us explanations in order to better understand anxiety in youth. Through the systems, we can hypothesize how parents may have an indirect effect to the individual's well-being, and some of the development of anxiety in children may be due to learned behavior patterns from parents at home. There are three levels within Bronfenbrenner's ecological systems theory that can relate most to our topic. The first is microsystem. Through microsystem, the child's body, environment, and relationships with others are taken into overall picture and well-being of the child. The next is exosystem. Through exosystem, parenting stress may indirectly affect the child's well-being. Lastly, through the chronosystem, we see changes which occur during a child's lifetime.
The second theory is Erikson's psychosocial developmental theory. Here we see that attachment and the development through each of these stages account for a healthy and prosperous development throughout all the stages of life. If the development through these stages are not successful, children may develop qualities that may lead them to later develop a feeling of anxiety. Erikson would say that social phobia, behavioral inhibition, which is fear of any unfamiliar setting or people, might result in anxiety due to unsuccessfully passing through this first stage and developing the virtue of hope, causing the child to use anxiety as a coping mechanism. When a child develops hope, they will believe in the goodness of others without having the suspicion that people cannot be trusted. Bacedo 2009 mentions that overprotection increased the risk of anxiety disorder as well as parent-adolescent disagreements. Parental overprotection and parental rejection mentioned by Bacedo associated with anxiety can also be explained through Erikson's third stage, initiative versus guilt. If children do not have this freedom to explore their abilities, they will develop inhibition, feeling as if they must be always doing something to have a sense of self-worth. Therefore, anxiety develops as a coping mechanism.
There are a few similarities and differences between these two theories. For example, Bronfenbrenner's theory mentions a level within the system known as microsystem. This level focuses on the self and their relationship with others. Although Bronfenbrenner's theory does not have stages like Erikson's theory does, they are very similar in the sense that Erikson also focuses on the self and social interactions with others as well as environmental factors.
School psychologists can provide some techniques for children with internal and external forms of anxiety. Some projective techniques are behavioral rating scales and interviews. Behavior rating scales are the most common form of assessment used by school psychologists, which measure the severity of the problem the student is facing. If interviews are used, school psychologists should use open-ended questions to allow for students to talk more freely about their feelings and emotions. Involving parents, teachers, and everyone in the child's life will help learn more about the background of the child and increase involvement between all stakeholders. Mindfulness, giving students test-taking strategies, and teaching various coping mechanisms will help reduce the level of anxiety they feel. Creating workshops and school presentations to give more information about this topic will enhance a more positive environment at school for the child.
Some limitations to this research are as follows. Huberty 2010 mentions that some of the challenges on this are determining the reliability of assessments done to determine the prevalence and patterns of anxiety incidents, such as severe and less severe patterns of anxiety. It is also challenging to understand what characteristics are predictors for more severe cases of anxiety and which ones are associated with less severe patterns of anxiety.
Some recommendations for future research are to identify early recognition and prevention treatment strategies for anxiety in childhood to adolescent lifespan.
Thanks for listening.